Now we're going to be going over the muscle dysfunction tests, and these aren't all just over the same muscle groups. The first two that we're going to go over are the Federer Test and the FADDIR Test, and these are really basically the same test, just done in two different positions. The first is the Federer Test, and what you're going to do is ask the patient to be sidelined. You're going to take their leg that is affected and bring them into hip flexion and adduction, and then you're going to force them into external rotation and see if this hurts them on the back side. So they're either going to have limited motion where they can't drop their leg down and get into this position, and or report pain. And again, a lot of books talk about this as being a piriformis test, but we also now remember we talked about it's not just piriformis syndrome, it's also deep gluteal syndrome, because the piriformis doesn't necessarily have to be the only muscle that's messed up, because there's 5 other muscles that do external rotation, plus there's a lot of other stuff like your sciatic nerve and everything else that can be messed up. So keep that in mind. So that's a Federer test, and then if you ask them to lay on their back, so in supine, the FADDIR test, and again, I don't know why they're considered two different tests, because they're basically the same thing. Again, you put them into flexion, a little bit of adduction, right? Because FADDIR, flexion, adduction, and then internal rotation, and you're doing the exact same thing, just with them in a supine position. And this is a FADDIR test, and again, you're looking for pain, you're looking for diminished range of motion, and again, you're comparing these bilaterally. So if she can do everything on one side and not on the other, she has differences in pain, that's really what you're looking for. So then we're going to move to the tests that we're going to do more for looking at groin pain and everything else. So these are going to be associated with osteitis pubis, rotated tubercles, so if we're having like rotation from either the nominants or something like that, symphysis pubis issues, or groin strains, and sometimes these will also be tender when we're talking about the athletic pubalgia as well. But these are all adductor tests, so the stuff that pulls you to the inside. The first one is the single leg test, and this is so easy, guys, like it's the silliest thing ever. You bring their leg up into 30 degrees, and then you're going to ask them, and you can support at their hips or on their opposite leg, and just ask them to pull their leg into adduction, so pull it to the center. And if they report pain, the same kind of pain that they had before, that's a positive test. Super hard, right? Then we have the bilateral, the double leg one. Again, you bring them up into 30 degrees, and then you just ask them, you can bring them out a little bit, and then ask them to pull their legs together. And if they report pain in that same area, so in this general central area around their pubic tubercles, their symphysis, or their adductors, that's a positive test. The last test for that is going to be the squeeze test, and for this, every time we're in, remember, hook line position, yep, we clear our hips. She already knew what I was going to do. You clear your hips, and then you can put 1 or 2 fists. I typically put 2 fists between their knees because it gets them in a more separated position to start with. And then you ask them to start squeezing lightly and then start squeezing harder and harder and harder to see if it starts causing any pain for them. And then a positive test is, again, pain. Now, I will tell you that if they have any kind of issues with their pubic tubercles being off and pubis symphysis issues, doing this isn't only the test to find out that it's messed up, but it'll also fix it. When they're squeezing in, what will happen is they are going to feel pain, and then all of a sudden they're going to feel a pop when the pubic tubercles realign. So again, one might have been superior or anterior or rotated. And what happens is the muscles are going to pull them back into alignment. The pop won't feel that great when it first happens, but after it's realigned, they will be feeling so much better. And then you can redo these tests, and their pain should be way down when you do the pain scale with them. So always do it before you do a test and after you do a test.